Hey friends, welcome back to another episode. Today we're going to talk about 5 transferable skills for public health students to master. Hey, it's Amari, CEO and founder of the Public Health Millennial, where we help you learn, navigate, and transform your public health journey. Public health is a broad field. Thankfully for you, there are many transferable skills that you can learn and develop to make you a competitive public health professional, no matter what path you take. That sounds important, right? Because who really knows where they're going to end up in public health? Okay, let's start with networking. I wouldn't traditionally consider networking a skill. However, given everything going on in public health and the job market right now, it has to go on this list. The importance of networking can't be understated now. And how I want you to think about networking is who are your public health friends, who are their friends, and who are the friends of those friends. And how can you make deeper connections with those direct friends and those other friends? Networking is all about relationships. It's important to cultivate deeper networks right now as a student as you develop into a public health professional. Connect with your peers, professors, preceptors, or really whoever you find interesting. Make sure you put your best foot forward. As you develop your network, you can leverage it for jobs, advice, and insights, like we've heard many, many times on the interviews of Public Health Careers podcast. Make meaningful connections and be sure to subscribe so that you can learn more about networking and how you can do this effectively in coming episodes. All right, transferable skill number 2 is needs assessments. Needs assessments are a vital part to public health practice. How do we help communities if we don't know their needs? To get a good picture of the community, we have to understand the community assets and strengths, the weaknesses, gaps, and opportunities. This is the only way to get to real community change. The golden rule in public health is to engage communities and meet them where they're at. I'm not saying you need to learn all the nitty gritty of community health needs assessments, but what I am saying is that with anything you do in public health, you have to start where the community is, and that starts with not only building trust, but also understanding their needs. Being able to do a needs assessment or some aspects of them can be transferred to so many different roles in public health. Even if you don't know how to do an entire needs assessment, there are some skills like focus groups and survey development that can be beneficial in your career. So learn how to identify the needs in a community. All right, transferable skill number 3, data management and analysis. Data management is a skill that can help your job prospects in many fields and sectors of public health and outside as well. I would say it may be one of the most financially sorted after skills in the public health landscape at the moment. There's tons of data out there, but who's analyzing, translating, and making it understandable? Well, this could be you. Cultivate how you interpret data because it is valuable and used in so many public health rules, and as I said, even outside of public health. Don't sleep on your data classes. They are valuable. There are varied levels of data management and analysis depending on what you do in public health. You can be using programs from Excel to online databases to R, SPSS, SAS, GIS, and more. I can't be too specific here because data management and analysis is broad and it could really depend on what you are trying to do and where you're trying to go in public health. When you're thinking about data analysis, you have to think about who is your audience and what data is most important to communicate to them. Pay attention in your data classes, even if it isn't something you ideally want to have a career around. You have to know enough to be dangerous. All right, transferable skill number 4, report writing. Report writing sort of builds off of the 2 previous skills, needs assessments and data management and analysis. Being able to write reports or do technical writing is a must have skill for public health career paths. One thing I think many MPH programs lack is differentiating between research writing and report writing. Though they are similar, they are very different, and we'll dig more into that into another episode. A great way to gain this report writing skill is to start reading more community health needs assessments and other technical documents. You can also ask for more of this work in your internships and be sure to be intentional in your classes to write reports, aka research papers and other papers that you're doing that can be translated into real world situations. Everyone needs someone to write up reports. And the last transferable skill is collaboration. Yes, yes, I know what you're thinking, but I hate group projects. They are so frustrating. Collaboration is dumb. Well, unfortunately, if that is you, collaboration is a huge part of public health. Just today, I was having a conversation with three different partners from different organizations about a convening that we will be hosting collaboratively. You know where I learned this skill to be most effective in my work? It was through collaboration, through group projects and other types of projects during my MPH program. Use your group projects as a great learning experience for how you can work around challenging interpersonal skills. Sometimes you'll be leading, and sometimes you'll be led. Understand how to play both of these roles. Is someone being hard to reach and not active in meetings? Well, this may happen in your career. So instead of complaining about it, you should try to focus on developing techniques to get the most out of these situations. Public health is a collaborative field. The earlier you're able to know how to work with people, as difficult as it may be sometimes, the better off you will be in your career. Try to develop a collaborative approach to solving problems. Seek out experiences when you can work with people with different skill sets and knowledge bases. Yes, you may work as an independent epidemiologist or something like that, but I'm sure you still have to share your work in a collaborative manner with a broader team. Learn to develop the skills to be more collaborative. It will pay dividends in your career. So, in summary, wherever you are in your career, focus on developing transferable skills that will be helpful no matter which career path you choose or chooses you. Leverage your skills and experiences for career success. As an early career professional or public health student, now more than ever, you have to develop these transferable skills and get experiences that set you apart. To summarize, the 5 transferable skills are: 1, networking; 2, needs assessment; 3, data management and analysis; 4, report writing; and 5, collaboration. Thanks for tuning in today, friends. If you found this chat insightful, give me a thumbs up and don't forget to hit that subscribe button and share it with a friend. Until next time, keep learning and keep thriving. And if you're looking for ways to develop continuous learning and development as a public health student or professional, check out this video next.